Hi everyone, I'm Dr. Lasya Sindhu. I'm an ENT surgeon and a neurotologist. So today I would be talking about ear infections, typically during the rainy seasons in kids. One of the main cause of, or I should say, one of the most common cause of ear infection during the rainy season is typically automycosis. Now you must be wondering, what is this automycosis? Automycosis is nothing but a basic fungal infection where certain fungus, typically candida, it grows in the ear, and the problem with this is it keeps multiplying and also causes a lot of pain due to the otitis externa, which is usually accompanying the automycosis. So typically your child feels that his ear is blocked, and it might be very painful for certain people. So quick solution is you need to go to the nearby ENT doctor and get your ear cleaned. I repeat, it is very important to get the ear cleaned, and appropriate treatment, which is antifungal drops or tablets, antihistamines would be given, and then the child is fine. And not only this, after swimming also there are high chances of developing the automycosis. Not only swimming, when there are a few kids who play a lot with water, so there is usually a lot of water going inside the ear, and immunity wise, if the child is little low, there is a chance that they develop the automycosis, which is the ear infection due to fungus. So this is number one. So coming to the next ear infection, which we see commonly in kids, it can be ASOM, which is acute suppurative otitis media. So what happens is, we need to understand that the nose and ear are interrelated, and for few kids, they are more prone to cold. So due to regular nasal infections and cold, there might be some infection which can pass from the nose through the eustachian tube to the ear. So when this happens, in few kids, we see that there is a lot of infection which gets accumulated behind the tympanic membrane, and after a certain pressure changes are caused, and if there is a lot of infection, suddenly the eardrum might burst. And after the eardrum, and during this phase where the eardrum bulges, is the phase where the child is writhing in pain. It is a very painful condition where your child will be crying that there is a lot of ear pain. Once the eardrum bursts and the typical purulent discharge, that is the pus, comes out, the child typically feels a little relaxed. And but still, however, there is irritation because there is some amount of ear discharge coming out of the ear. So this is typically called as acute suppurative otitis media. But if these episodes of ASOM are going on again and again, they might cause a permanent perforation in the ear, and this we call it as chronic suppurative otitis media. And other than these, coming to the other category of ear infection is the one where child develops a lot of ear pain. Typically, when you press this is called as the tragus of the ear. If you can see over here, this part, this is known as the tragus. If you just press the tragus, the child writhes in pain. This is usually due to otitis externa. Otitis externa can be due to various reasons. One reason can be a furuncle, which is a pustule, which is a boil-like thing growing inside the ear canal. Number two is some kids have the habit of cleaning their ears with earbuds, and they might cause some trauma in the ear, and this might also lead to otitis externa. And other than this, there can be normal infections or any trauma to the ear, which is a very rare thing. But sometimes when the trauma is so severe and the perichondrium is affected, it might cause a perichondritis, which is an ENT emergency. They have to be admitted. They have to be given IV antibiotics. So otherwise, there might be permanent deformation of the pinna. So please keep these things in mind. And whenever your child has any ear-related infection, kindly consult the nearby ENT surgeon. Thank you.